Yad kododa nichinaligi, Dysonoft agi, Shig Nini. She ya Niagara Rockbridge and she, Kia Ani Nashne, Ashkan the Hobash chain, Nakadina Dashe, Tohana Dashanale. She Nakademil Dava Anadi, Fly Hagido, Nakademil Dava Anadi, Naki Hahagi, the Nebaj Kenshne. Kodo yad o ya nanat in hidini dole, do ya the hidini dole, Kodo dan hinaligi, that she Dysonoft aunt. Kodo yahashi breast cancer awareness do prevention wal yehegi eshin kodo Rolanda Todecheenie wal yego eshin kodo hije hototze ako Rolanda.
Good morning and good afternoon to everyone out there. Thank you for allowing me to be here. I am Rolanda Todecheenie. I'm the case management specialist for the Navajo Nation Breast and Cervical Cancer Prevention Program, and I work out at Chinle Women's Health Program. And my presentation here today will be on breast cancer awareness. What we're going to talk about today, here's an overview. You're going to see the program overview with our program, and what is cancer, what is breast cancer risk factors, breast cancer screening and early detection, breast cancer warning signs, reducing your personal risk for breast cancer, and then the Navajo translation that we utilize for our program when we are talking about breast cancer at the Nebazaj. Okay, what is cancer? A lot of people out there wonder how and where and when it occurs, but the most specific information that we can provide you coming from Western medicine is the term cancer. It refers to more than 100 different diseases that begin in the cells, which is the body cells. And you have a structure of a normal and a cancer cell. So the normal cancer cell has the cell structured. There is some round edge boundary edges on the normal cancer cells, and it has the nucleus of its own in the center as well. You can see all the normal cells there. But once an individual is diagnosed with cancer, the one where the cancer cells are abruptly growing and developing into different types of formation, there are different shapes. And that's when you know that that cell has become disturbed, and it's also the patient has been diagnosed with cancer or is in the process of having to go through screening or different types of procedures that are needed to identify to see if the individual does have cancer. When we talk about cancer itself, I mentioned that it does develop within the cells. When they become abnormal, it can lead to a tumor, and tumor is cancer. Once it reaches that stage, it can divide from there into more cells. The invasion of it metastasizing, it can metastasize quickly. Once those cells don't die off on their own during the process of an individual having to live every second of every day of their life, when certain cells don't die off on their own, they start to build up inside the tissue cells itself. And from there, you see the PowerPoint presentation here. It's going from the cancer cells, it's invading the surrounding tissue and the blood vessels as well. From there, it's being transported by the circulatory system and distant sites. And the third section there of the presentation, it's indicating that it's growing into a new location. That's what metastasize means. It's the form of cells that's growing uncontrollably. There's no order to it anymore, so it's growing on its own into other parts of the body beyond where the actual cell became disturbed or became abnormal and turned into tumor and then cancer cells. Now, when I talk about cancer, my specialty is within the area of breast cancer and cervical cancer. And we are talking about breast cancer awareness today. So a female, this is the structure of their breasts, and every female that has a breast structure there, it's they have the ducts and also the lobes itself. You have what they call lymphoids under your underarm area as well. There's also vessels there. All of that is attached to the breast itself. You see the nipple there in the center of the breast area where it shows the diagram. Then you have the lobes and the ducts. So that's where it usually occurs when we do talk about breast cancer and when we have to educate our patients out there. When that occurs, you have the abnormal cell growth. The only way that an individual can be diagnosed with cancer of any type, both genders, female and male, is if they identify the abnormal tissue cell at the organ site. From there, they continue on with additional imaging or either procedures that need to be done as of to a biopsy. A biopsy can be done with like a needle biopsy. They'll go in and take a portion of the abnormal tissue cell out, or they'll surgically remove the whole disturbed and abnormal tissue cell from the organ or from the body. From there, they test that through the lab. They'll go ahead and send it to the lab. You're only going to end up with two results. And one of them is benign, which we hope for in every patient that has to go through any type of biopsy, which is non-cancerous. From there, they'll just monitor the patients. Some come back in for 6-month follow-up. Some I've seen come back in for 9-month follow-ups, and then some of them are within the next year. So we look at all of that, consider all of that, what the patient's going through, and the procedures and the additional imaging that is needing to take place. But there you have the other type of results that you'll get as malignant. There is cancer, and that's a whole different perspective again when we do talk about Western medicine. When an individual ends up with a malignant results, that means the area where they see the disturbed tissue cells and the abnormal tissue cells, it's identified as cancer. From there, there's additional visits that will occur with the oncologists, and they come up with a plan on what would best fit the patient as far as the different types of either surgery or treatment that is needed. In most cases, a person with cancer will end up either having surgery done, or either they'll end up having to go through radiation or a combination of chemotherapy with it as well. So it's really up to the oncologist if a patient should ever reach the stage of a malignant results coming from a biopsy that was done to their organ, to their body, in this case to their breast area. These are some of the known risk factors here, and here are some of the known risk factors. These are some of the known risk factors here when it comes to breast cancer or any other type of cancer that's related to us Native American population. A lot of it's got to do with the family history itself. You have to consider and look at what the family history is when it comes to an individual that is diagnosed with cancer. And you have to look at if the first degree relative or if they have a family history of breast cancer. And then your diet also plays a vital role when it comes to risk factors. The type of food that you eat and what we have to consider as far as having to eat nutritional food for the body and what is needed for the body nutritionally. So there's some of us that don't consider or don't watch our weight, and it can cause some issues as far as the certain organ in the body part that will have some complications because of the amount of body weight that we carry as an individual, both genders. Then our hormones as well. We all have hormones, both male and female. And, with the female, it's the hormones that we carry and that carries throughout our body, and having to experience the different types of issues that we have to go through, especially if it's through our menstrual cycle, having to end up with menopause at a later age 45, 50 plus years old. So, and then aging, there's really nothing we can do about our age. We're aging every day. So we have to consider taking care of ourselves and making sure that we are having to eat the right food that is good for our body as well. So these are some of the known risk factors when it does come to us as Native Americans, and then also being a female as well. So as far as the program that I work for, the Navajo Nation Breast and Cervical Cancer Prevention Program, many people probably wonder who it is that we screen. And we have a mobile unit that we have a memorandum of understanding with. So they're a vendor that's out of Tucson, and they do a lot of our mobile mammography screening, and they're assured imaging. And they come up here to the Navajo reservation, and they come out to the IHS facilities and 1638 facility out in Winslow. So we are in collaboration with them. And the guidelines that we follow are the CDC, because we're federally funded through our grant, that our program under the Navajo Nation Breast and Cervical Cancer Prevention Program. We have a grant that we work under, and that allows our program to pay for women to be screened at least every 1 to 2 years between the age of 40 to 46. Just because you see these ages here doesn't mean that women don't get screened that are 39 and younger. We have seen women come in with issues or concerns or abnormalities to the breast area that are 39 and younger. And then women who are 65 and older also get screened as well. Now, under the United States Preventive Services Task Force recommendation, there is the biannual, which is every 2 years. Screening takes place for mammography for women age 50 to 74. So there's a big 10-year age difference there between what our grant allows us to pay for women within our age eligibility versus the United States Preventive Services Task Force. So we have to consider all of that. And the diagram there shows that the women 40 to 49 is in the pink shaded area. And those women can come in on an annual basis, but some facilities or the providers will recommend that they get screened every 2 years. And then the 50 to 64, which is our age eligibility for our program, they can get screened once a year, every year. Then the 65 to 74, in most cases, it's either alternate resources, which will be their health insurance, or either the IHS will pay for the screenings for them. So that's who we screen, and that's how we work with these women within these age eligibility. So when we talk about breast cancer and when we do talk about mammogram screenings, we normally explain to the patient the process that they're going to go through. Some women are well aware of what they go through, especially if they come in on an annual basis. They already know what's going to take place. They're just there to complete the paperwork and go about having to get their x-rays of their breasts, and then to make their way out, and they're done for until the next following year, or until the results come back, and that'll determine if they need to come back in or not, or if they're going to be coming back the following year. So what we're actually having to have the x-rays that are being taken of these women that come in for the mammogram screening is finding a lump. So the majority, which is about 80% of the breast lumps, are not due to cancer. We have to explain this to the patients. Just because you end up having an abnormal result or you find a lump on your own in your breast area or underarm area, it doesn't mean that you do have cancer. There's such things as what they call cysts, benign tumors or changes in consistency. It's due to the menstrual cycle as well, and that can cause benign breast lumps. That's why when we educate on having to do your own breast self-exam on a monthly basis, we normally inform the women not to do their breast self-exam while they're on their menstrual cycle, because that's when the body is changing. The breast is a little more tender. Sometimes it becomes enlarged during the menstrual cycle. So the body is changing, the hormones are passing through and all. So that's why we informed them not to do that. I said, if you don't believe me, go ahead and try it. You're going to find you're going to find like BBs connected together. And that's like the lump that we're talking about. It may form into that. And, I don't want them to be afraid if they come across that. So those are some of the things that we have to educate on as well. And it's also important to let your doctor know of any type of abnormal tissue cells or lumps that occur within your breast or that you find. So always keeping in contact with your provider, keeping them updated of any changes that you notice or that occurs when it comes to your health or either to breast cancer awareness in general. So in most cases, we do say early detection of breast cancer is associated with the high rates. If you don't come in or don't get your annual screenings done and you wait until the lump starts to get a little larger than what it was, or you come across some of the abnormal breast cancer warning signs, and you finally come in, there's things that could have been taking place and things that could have been done on your behalf prior to allowing or having to have that lump enlarge even more and cause it to become a tumor, and tumor is cancer. So that's where the high rates come in at when we talk about finding a lump. And then you see here the upper section of the breast here, and there is a lump itself that is being detected by the x-ray of the breast here. So this is what they look for, and this is just all the glands and the nodes that are in the breast area. So this is the tip of the nipple here. So this is pretty much the x-ray of a breast when the radiologist does see the images of the breast. So they have to identify what they see and what is considered an abnormal tissue cell and a possible benign screening that occurred. So we let them take care of all of that as the radiologists. The stages of breast cancer. It's a process of determining, like what I mentioned earlier about the previous slide, is to what extent it has a tumor or whether it's spread within the body itself. And then also the staging takes place after the cancer has been diagnosed. So we try to prevent that from occurring. But with the breast cancer, there's the stages that is being documented from 0 all the way to 5. So 0 is some abnormalities are going on within the breast. They come back in for additional imaging. They may get, or their provider may request for a diagnostic. It can be unilateral or bilateral, meaning either just the section, the breast where they're finding the abnormal tissue cells, or are they going to do a diagnostic and look furthermore into both sides of the breast. And then you do have the breast ultrasounds that take place as well. And normally that's done at the main facility, the main hospital, the IHS facilities. And if they have a fixed unit there, they have a breast ultrasound tech there, they'll go ahead and take care of the breast ultrasound there as well. So the BIRADS 1 and 2, that's normal. They come back within another year. BIRADS 3, that is when they notice some abnormalities and they just keep a close eye on it. They'll have the patient come back in for a diagnostic, possibly a breast ultrasound. And if they come back as a BIRADS 3 or 1 or 2, and then they'll have them come back in again until another 6 months. And then a 4 and a 5 is when the doctor is their main concern is that we need to get this patient back in as early as possible and have them get the additional imaging and to see where the actual status of the abnormal tissue cells are at. So if it ends up in a 5 or beyond, and then the doctor will inform the patients and let them know what the next steps are. So both the stage and the type of the breast cancer, it's very important to determine the breast treatment and the plan that is needed. So if you look in the upper left-hand corner here, that's a normal cell there. And that's where it's inside the breast ducts itself. And if you look down lower to that area there, the next image there, it's starting to close up with the abnormal tissue cells there. And then the lower one there on your bottom left-hand corner, it's become invasive, meaning that the abnormal tissue cells have pretty much turned into tumor. Now they're going to start metastasizing to the other parts of the body, like where it says the breast duct. It's going into the other area of the breast as well, into the lymph nodes. So this is what we're trying to prevent from happening. That's why we encourage women to come in as early as possible, normally once you turn age 40. But if you're 39 and younger and notice any abnormalities going on with your breasts, it's best to come in and talk with your provider. Make sure you are communicating with your provider and following any type of instructions that you're given, or the type of information that is given, what to look for and what to be concerned about when it comes to your breast health. When I talked about the biopsy portion of the breast, this is one of the procedures that is normally done. You see the image there and you see the needle there. And that's an abnormal tissue cell that is right there in between the ducts and the glands there. So the biopsy is done. That's one way it's done, where it's needle biopsy. Then it can go in and surgically remove the whole abnormal tissue cell that has developed in the breast area. And that's the most certain way to determine whether a breast lump is cancerous or not. And the biopsies, it may be taken through the needle or through a minor surgical procedure, like I mentioned earlier. And then the results can also determine the type of breast cancer that is present there. In many cases, you see there's several different types of breast cancer. So a lot of that will determine that as well. And then in most cases, most of the treatments are tailored to the specific type of breast cancer that is present. So it'll all depend on what the doctor and the oncologist is seeing, how they're going to evaluate the situation, and the type of treatment that this patient is going to receive once they get diagnosed with breast cancer. So this is the biopsy that I was referring to. This is the only way that an individual, both male and female, can ever get diagnosed with cancer, is if they go through a biopsy procedure. If it comes back benign, it's non-cancerous. And then also when it comes to the malignant, then meaning it's cancer. So keep in mind that men can get breast cancer as well. 1 out of 1,000 men. So you get 1,000 men together, and one of the individuals of that 1,000 can end up with breast cancer. It has occurred. I've seen it occur here on the Navajo Nation. And I see some of the reports come through from the women's health provider having to check a patient, a male individual, because they found a lump or they have some of the breast cancer warning signs, that they have to get seen by the provider. I also witnessed where a male individual had to get a mammogram screening done as well. It wasn't a breast ultrasound. They did a mammogram screening on him, and thankfully that results came back normal. So I had to explain to him, just like I would be talking to a female, but I had to inform the patient that he doesn't have the ducts and the glands in the breast area. So it's all got to do with the tip of the nipple area, and he doesn't have male don't have lymph nodes. So that's some of the education that we provide, and we have to encourage the men to also try to do their own breast self-exam. May not be on a monthly basis, but at least check around your nipple area, men folks, male individuals, just to make sure that there's no abnormal tissue cells like lumps that are developing around it. If you notice that, we recommend that you do see your provider as soon as possible, just to make sure that we are providing the safest and the most accurate screening that is needed for you. These are some of the breast cancer warning signs, and I do educate a lot on the breast cancer warning signs. I make it known to individuals that I come across, whether it be at an educational booth, whether it's going to be at a PowerPoint presentation or an invite where I'm able to provide a presentation to the general public of all ages. So some of the breast cancer warning signs that we normally educate on is a change to the skin texture or color. Sometimes the skin will look like an orange peel, the thickness to it, the rippling in the orange peel. Sometimes it may stay in one section. Sometimes it'll go to a different section of the breast. This one here, the image right across from this section of the change of skin texture or color, it's right there on the inner part of the nipple area. So that's where it looks like an orange peel there. So that's the best way to describe it, and try to make it known to the patients that can occur. A depression or a dimple on some part of the breast area, the surface of it itself, and you should have no dimpling at all in your breasts. On your breasts, you should have one skin texture, top to bottom, side to side. This is why it's very important that you make every effort to do your own breast self-exam. Utilize a mirror if you can, and stand at the mirror to make sure that both sides of your breasts are developing the same size on both sides. Look at your nipples as well. Make sure they're straight across as well from one another. And this is where you would check to see if there's any type of dimpling in your breast as well. The other one is the change in the way the nipple looks. This one here is like an inverted nipple. It's like pushing in the tip of the nipple, and it's not going to convert back out on its own. It's going to stay inverted, meaning like you push it in, it's not going to come back out. So this is one to look for as well. And if you need the mirror to do that as well, this would be the best time to make sure that you are checking for that as well. In some cases, women who end up with an inverted nipple, and if they go in and see their provider, they'll check to see when their last mammogram was. If it was done more than a year ago, and then they'll go ahead and have them get another mammogram screening. If that comes back normal, in most cases, the inverted nipple will stay there as well. It's not going to convert back out, and it'll just stay like that. So that's usually noted and documented in a patient's chart or EHR, electronic health record. Then when the provider comes in and sees that, they'll either start asking questions or ask if they have any other complications or concerns or warning signs that they're aware of. And then the discharge from the nipple as well. A woman who is not pregnant or breastfeeding should not have any type of discharge from their nipple. This one can come in clear fluids. It can have streams of blood in there as well, and it can also have pus in there. So this is what you're looking for when we do talk about breast cancer warning signs and having to do your own breast self-exam, us females, on a monthly basis, picking one day out of the month to do your breast self-exam, but not during your menstrual cycle. And then the men folks, you can talk to your provider about it as well. You would mainly be checking around your nipple area or circumference within the area of your nipple. So through all of this, you're probably wondering how you can reduce your own risk as an individual. You can be physically active for 40 minutes or more per day. It doesn't have to be strenuous exercise or be physically active. You can be walking, you can be jogging. Some people like to ride the bike. Some have access to a swimming pool. Some have access to their livestock where they can go horseback riding. So there's a multiple ways of having to do your physical exercise on a daily basis of 40 minutes or more per day. You can also break that up if you'd like and do like 20 minutes in the morning, 20 minutes in the evening, in the afternoon, 20 minutes in the evening, and just continuously make sure that you're physically active 40 minutes or more per day. If it's more than 40 minutes, that's great. You're putting your risk for breast cancer at a lower rate. And then we did talk about the diet, some of the risk factors. You're having to eat a healthy diet, more fresh fruits and more fresh veggies. This is pretty much organic and there's no additive to it, such as the canned or frozen food. So you're eating organic fruits and vegetables, and it's good to mix that up as well and make it as colorful as you can when it comes to your fruits and then when it comes to your vegetables as well. And this one here is cutting down on alcohol consumption. Some individuals do consume alcohol. That can put you at a higher risk as well, especially when it comes to abnormal results, or either if you end up with cancer, having to consume alcohol is not going to help it at all. So if you're consuming it, try to slow down on it or stop drinking or don't drink at all. So that's the best advice that we could provide you when it comes to risk factors and how different types of things can affect the human body. Here with the Navajo Nation Breast and Cervical Cancer Prevention Program, we do the mobile mammography, like I mentioned, across Navajo land. So we are the program that pays for this mobile unit to come on site. And if you start off from the upper left-hand corner of there, going down into the map section area, we go out to Inscription House, and then you have Chichimbito, and then you have Kianta, and we do have Red Mesa as well. So that's where the mobile unit goes, up in the northern part of the Navajo reservation. Then if you come down mid-low down to the map, the Navajo Nation map, you have Pinyon, Chinle, and also Saley. That's where the mobile unit goes, and we go to either the hospital like Kianta IHS and Chinle IHS. Then the other sites are satellite clinics, and then you have the Tohatchi Health Center as well. And we're going to be also going out to Pine Hill and Theru. Then we go out to Tohajile as well. We provide education there. We assist the patients that come on site with documents or forms that need to be completed, especially if we need to translate in Navajo for them. We'll do that as well. And we're going to be heading out towards Rama, and we go out to Winslow Indian Healthcare Center as well, and then to Flagstaff to NACA, the Native American Community for Action facility. And that's a small clinic there in Flagstaff, so that's where we normally go. We do have the fixed units, and they do have a fixed unit in Tuba City, but that's a non-BCCP partner. Then they have one out in Shiprock at Northern Navajo Medical Center as well, which is also a non-BCCP partner. Then in Fort Defiance, Sahoto Medical Center. And then you have Gallup Indian Medical Center, who are also a non-BCCP partner. Then over in Crown Point at their IHS facility. So that's how we travel, or that's the coverage area for the Navajo Nation Breast and Cervical Cancer Prevention Program when it comes to mobile mammography. And this is the Navajo translation that we utilize when it comes to breast cancer. As you can see here, there's two words there, breast and cancer. But if you were to translate that, because of the Nebazad being very unique and the way that we have to be as descriptive as possible when we do speak our language, not only that, I broke it down as well, having to use the English version of what each section of having to translate breast cancer into Navajo. At isbet or say as you can see, I didn't say a son of a bet because both men and women can get breast cancer. So that's spot didn't say. So it's isbet all, that's the human body cell. That's what our body is structured from, is the human body cell. Didn't say, that's where it develops and it grows. That's where the uncontrollably section of it, the portion of it, and it becomes abnormal. That's identifying the body part where it's developing in, which in this case it would be in the breast area. So it's and this is our information here. It's the Breast and Cervical Cancer Program, the Navajo Cancer Prevention Program. And here's our address for our main office in Window Rock. It's PO Box 1390, Window Rock, Arizona 86515. You have our phone number there. We do have a fax line as well. And the website and also our email is there too as well. And then also we're on Twitter. So you can find us there if you need additional information or any guidance, or if you would like a presentation done as well, we are available for that. Thank you for your time and effort. I do appreciate it. Say change kenen shnet kapa ebas chain kachini dash chain dot Todecheenie dashnad Rolanda Todecheenie in chen lage and lage son in the not age a Chinley Women's Health Program ibanashnish Adoti Koje Navajo Nation Cancer Prevention Program a adult all shanan the sheet hiki a case management specialist a with oshanan the DJ Eko Kodobada Iki a Horse Kit when the older Baka a Shibanash Shido a Hit other English door Ashis Kit when the all by a day kit on this. I don't the Dikoja at least with all that we say I don't know the about a doing they hope. Is a the Lagonic category of what is cancer on the young. I don't know the AD at least with all that and sell about a doing they are happy then say breast cancer neniginan. I don't know the at least with all that and sell but I don't know. Ishe ka I hut all ye de net ido yin bis ka ho hut all is a put zido hashing so she about no at echo ishe so sa ba ya de hit on this. I don't the dots is with all that and sell ha baby then but I had no idea what baby then sell a arts of hut all been ye not what not ito a hut all hashing so a bit said do when hada is a hit all she should do she would all be yet zay the in Gerardo zay in the banjita arjipina is the kid on aron da di it's isbet all that didn't say other but no idea what that we didn't say how a education so but be said lahagi to a breast cancer warning signs is she hit on that ido hit up a queen zin do de up which is in the she be nice cut on de adon the da a hashid au a asasa zini sanjalon da other than the what on ne ho say in e alla de ni stwi hiji age e alla adi ho do ni lot en ko e se ya hit au na e do e ya which is in kish e hit au ahwe ata ka sto do aron da ba questions in do de di hut is hat e ado ze mo da na ta ho aron da ke de ba da ni ne ge e ya di sad nigi adın ne bezan hut au hashin so bi slagi aron da e hit au ya Nihidinne billa dan lenig eia beibil istana in deil do be bitia deil ti do fato be dan ni tin ho. E si wat o e kwado han negi hit e hoslet o leklije do je het kwa eichel da hon ni negi. Di kwado eia at isbit or dat in se ada ba da han de ho wat o a hit ada e eia billa in lenig bits isi no e ho. Alla nes na dyn don't know what o I chashin to she a dat o she what o what isigi not I thought ho I chashin to I could oba da ne ho could you go ajugo what o e dot hadan ledin de ha ho zel in dan lenigi Jano dan nes maso what o he jin han dan nes se ko die het is met orde die hij uit het al je gaat het al het al de nes do het had nach Johnny do die do eigenlijk al dat is met je nog niet echt dan no het al zijn in het nog ik do ja het no zich na na go hashin so at het is met orde dat nes zo in de het is het al baat die on baat het selling or has legal e aja with dan ajo na hano hot o da nessa to in the ness maso na hano hot o da huge da ness o da huge go dan ajo hot o I da nessa ko e shi hot o de se ho hot o I hashin to shi ya ba at hano la adon da jo no I ka jo do kha nas kha at the adi o e hashin to hot o Bilje is in the hut o aji gin yenna hagi oncologist they think aji hut o aji chato pa you see there's la hut ho ko nana di at isbit oligi ano ba at hadong le hot tin se ho jo di cancer nigi hut o yo je le ho jishita hut o shodo natsi jo hut o ide yo jin da hut o shi pa da hono sendo hut o shi ita do tsande ko ako shodo natsi no ande bil gan catch hut o sa bil kit nan de gi hajo ajaba na hanna o iya I khashin so iya a sore that won't heal jo hut o den se to don do zita hut o hit nebe bil da hut di afiki shi ya But she had loaned abici do abin ya hachi ya she lato zel in a kado so bini na edik at sad lengich de ni ko at ispit o that can say other but had long the hiki so ishe yisi no hot akodo ya na had ne ko edi at ispit o din hits isi that agi ni ket aton din hits it aje on the datin hits is of hits Sunday art when you had the age in the point. Age is but all the that ado the nice that zito hitchi now the up and later but all in that what on that nadan ado on me the ge kunne it's just but all not the ha nadan ho the asa with all is but all the gito up in that what in hota it's a joke in no she asagi o o aja hot oiki o no nasitness muscle that we didn't say ado that fata namas fata body didn't say it's is be yet ado that fata ines good on nisha Sani la hot o e bits is be be den se hot la e don es good dan ni la ho. But it's easy at dan ni la ho. Ni be ke chi gi be la khat hot o e aja hot o hun so da hot o ba be git la ne ho. Be den se la e an cha la. Don da hot o ke na a la. A ko di aja hot o be den se ho ko. Do ba at hit o hot o open di o no se to de chen za ro da ze o ji do ka shen ne sa to da hit I do de shen ne open di go o hot o be shin ji ga shi o na si o cha da an ni lo ya di at is the oligi ba at no de ho be hot isigi bi den se ho shi na si o na so no se lo adon da ya di ayisi di watsan leida ada utsada ende hlachigo o hot ayi da nesse le ko la huge o ye de chit na no hot o hot o hot isigi ye not e o ho e hashin to ko do ya had ne do ki na o di do ni no ko nana di asanan dinigi hashin to be chi ya bi hadet ko bahasa no tabaka ko lymph nodes adon da vessels din le which ya hone ko be that's ado hot of date hege in le which ya hon ko ado di ho be ye hadet hege ya lobes ado ducts ko lobes ge ya adan chana di ducts ge ya adallt also wat os na no si hut af gyda di ade ho. Ado stanni il tado you see aja hashin to ya breast milk de kliniki hut af wait nan wait do di do wait do chilo hut o aja hut af lato pa mailt o do le ni aja hashin to si chaide leile na ho di ho begi ho stanjelo dort do si hut o lato benan is yosen on leje hadis away chiche ho ako e bit a honne e sin hadan ho de si la bit dat se ko ada on de ta hadait au hut I lato ha ila benna hut I jodan ni le ko has tweede go die lymph nodes de klinike aja ba hatan do nana lobes do taxigi so aja ba hatan hada tweede go don da chi ta sani go yan le be best de aja hut aus tweede go hut au be bit si ge hatet ho ko be at ko aja tweede sani kon da has tweede go hud on nílad hud ábíd nó ílad ina bhil ina a honóia had net le ko. Nana di at ispit oligi hud ádachtn sého adon da bad had no leho. Zeil inan déis chaho do abe hud á da hun zinní á adon da chalid á ibla slaige ibecha ó was lid abba ó nílo lid abba anna ó níl Queen o si wat even hat dit di hashin so at isbet oligi wat den seho ado bazno de yo od ya sahagi dalle sahagi da wat de in le ha gishi sin de nes sanage adela nach hui it sahagi be ado dai da no ne wat da gisto ya de nes sanagi wat nes massa da bit de nes sanne in nature wat do listo le yen ye wat da de dichta ado da bit het is bet oli da bat no le ho wat dicht ga po laboratory dicht ne ho ade na dicht ga di hashin so ade not wat not so si ga di de tado dit abi tabakada no so outside in the initial deep benign ni ki joy do bat no dan o shi abi nesado o Dapat not ilan they strand zido da aronda in binya nadi datli asana fidget no da hut o zel inige si hut o belashla ye zel on da ya hut o ye ich dann yosen do Nana llai e malignant jo ik at aja at isbit oligi baat hasnio hut out at nessa ik at hut out de yon aja sto hashin so ya sato babik iya doti ada on the day aja zel in ya to gasto khalit apa to nek jo ke kuna o hashin so aja hut o ye yin ye nada ha ada hut o sato ya Bacardi, was Bacardi, Jahwinson, Hashinto, Bananish, de Yosin, abnormal cell growth, the Nigi, Aja with Obinat Ha, do the Nebilash, like Bazano, Bishtan, Urzano, Hashinto, or Azel in the Yishishna had Netla. Nana di Kodo, but oh no, Hadit or a Baukush Nozik, do Hadit or a Nod haho bahazno dat shillato yashid not ilot eta do dat jo di kodo ti klijini klinigi aja hashin so ni na be hola ni klini de ni klinigi za han chit au dat na kito aja o be not il o god eta no da hot o ye han chit o ye da kha en ki khod ni shillato hot o lato ya بالأشلاء الندم كلينيكي بيد نوت إيثوت أن هو بعضنا ناس كا أو بعضنا أو نال أو دي يا دخل كودي زي الإندان لينيكي نانا أخوش زينيكي يا بتعادو جوغرافي بتعادو أنو تشيفيكي جو family history دخلنا أو إن لدي أو خشنتو أي دا أو but east ho give it hota but other per not just chon da other non still da so hashin so is up no chilo de saho ya kwa a man lenigi kwa bit haslin da it be not ik kon the bit ki kwa be we na haslin da ya other da be not ik no o ya hadne stunning ichiko nana the najigo ski chunda o man lenige ski chunda she baz no that do I yedo be not ikla kunde aja o da balchina hasli o da o sit da o by chun ya ani o be not ikla I don't know o ye nada ka ko zel endan lenige Nana aho zinigi shifto ata aho jigyalo de chiyan chijos inigi chiyan paat etenigi chiyan khas jo hut o hut o chiyan yadat git a necessity shi yisi hut o hdeni indo de lana la do de ida di chiyan za ashit khana la balta khagi khashin so oh dat dani zindo de down klapet o gilda has nana di chiyan ashi la balta khagi yadi zinda hot a chiyan da biyegi aja hot o shi la balta khagi shi so gits isto bayat eta to nana di jo illato beta isla hashimit ishi ado unde da anda la ats da o yo kata pa za fat o ita itan ha no ko ado fat o ji ho aten ti ho da to tha hostil ze ho da hashin so so apa at no la ko ashi fat isigishi hashin so ay not ilot ko ishi abe ita hoshin sendo le Ado di hormones de klinike di sanin ni klinike hashin so anna de zido het o hashin so bion en hil khanda bil jishko shi aja het on hit isi gi o ya yo lich na han hashin zach le ashla is card ashla the more that I know what to do and zao had just out needs is it how yosin or put out a yabi and his conduct just either art as she without be hormones no ya yasti ho zen and no the gana is to go nana the panahi Jojo a kuj ya hot of a shield so jo tea what is it tea do in le na din this din to naching and down without a ninja go with coffee nego da chana she bitch hat or let the costo that hegita on dashni higita jo hashim so nashed leho ya the hut is be hashim so yon then thought na do what our hajish the costa patli not da do either do be da ho jilia da shi so ya hashim so di jo Panache gishi do bohne zada daga shido shana do hata ahanta do ni gishi bohne zada ad about halit heknila do halit abidet ila do halit abita honsten do lit she wins and the known risk factors the clinic nana Shabanash Shidoho Navajo Nation Breast and Cervical Cancer Prevention Program Navajo Cancer Prevention Program with other Yoshila. He you see Aja with on the but not in she wins in the co. Dean lay Chida Adams RV that they know without the Yoshila coach that they know mobile van that they know without the Yoshila co. And then she though without a nash though has known later without the bakat in lay زي الانبل دهز آغو أبقى دلوا إي آجن كنان شكي إدي إيكو إي دي ساني دين دون دي ستخدين دو بقما دي بيدا خيجي إي آج إيسي بخل دي لشكو لي إيسي بين بناش نشدو هو Navajo Nation Breast and Cervical Cancer Program based on no tahagi join le ha achigo Centers of Disease Control they no CDC grant yisi biyalo they need lish de yisi based on no tahako be hut on hinan state ben nachigo aje behas ani beast so gido by his ani be bakagi ya di based on katfon hich de ya gi ishjan sani ko beda khigi aje ya public and not of leto de stanchi no even nach in hipodo latoshnamish in sinigi aja osani ye yahta ka do o hakko da be no ado that not sauce baz no da ka o sho ko da nach bis ato na adneta asha nach do stand ado hut ob hit da huina o in le asha nach na kinach da hut o aja yin ye ya ha ka ko sani ko be da khigi akonde kating do te bi be da ki do ya go sa an ye ya ki ka ko hashin so ya a be bit in da wit da alle bit is no ni do alle da zel in da ya na na da o ye ki na ni ka ho da ein ye sa ya ki ka ko di be ba ban kan da tla ko ya to da di ni da konde di ko chi si peso no ta ki ben na ko di on platon ki nan de nilsen nana di at ake ya ta sa an de ko United States de kliniki ho what e khashin so United States Preventative Services Task Force de no a hot di bla strain leniki do nana at is ba hayado biki this each a aja hashil so but ya in yeda da has ta ho a aja da no not ka ho ado da nes on da but not so sto a di banach a da biki ho da a aja de nes o a ya biannually with de ho an na kin nacha ka ho di san is Latin do Latin beda gedon le sabdin do ba di beda khigi joy aje isi o in also sin gi panan de ko ande zel en betin da has ano hot o khashin so lato banan is de yosin ko aje asti le zel ni bigiona ya khasa ko fix unit de aje hot o ye ye isani kanda jako konde la anja hakati lao kada hot o ya sato kanda ta hagi hoti mobile unit uli hagi ho e ajo on kinanis lengi de nilsen ho nana di sani but babben the cut this cloud of ado dai da babben the cut the cloud o da ado on the dakhlit oh de nas ila do ila yin de khashi queen zen ko di kwa e ya hashin so e ya sani ape le بعد هدول اللي هو يعطي تسبت أوليكي بعد هدول اللي هو أدوتي تاجي بيتن سهو أي أج فت أنس مسدا بيتن ساودا أي بيكج دلني ودا بيكج خبي بيكج خاودا أي أج أي يا تو أي يا دي تسبت أودا تنسي بعد هدول اللي هو بيتن ساكي تو أي دا جاب تسيد فت أبين ينال خاهو الكيف منا إيه يا هت 80% نه إيه ده هت إيه ده إيه ده نو هت يه نادا أشخاصه هت يه نادا مسكينه نانا كنا هت إيه هذا أشتو إيه يا دي أتسيس هت ديكي ليد ده أبه نحن خوان نيشو أدون ناسي سيستا ديشلون هت هذا بيتن سهودا إيه خاشين تو أنا نحن زي إنه هت إذا أكو جيشي أنا نحن هذا مو بك هنا تزيد بك هذا أو إيش بنيجي هذا هو خاطر نحن هو هذا عند داي هذا أزيل إنه فأزيل إنه لون جون اللي خارج شيء زيل إن جسنا جداه أو شايفيه زيل إن بانجداه شايفيه جو الناس أخذيشان ناسي أزاي إنا كتشوف اليادو تلتيك إيه كتشوف النادي دو تلك لي خاجو شي زي إن دبانا جتا تلتيك إيه دو ياشخون دا أدو تي كجندا نتي جندا هنا نتأتي هتسيس بنكان دلتلا جادو دا دي هو بأجي بنكان دلتلا دا هنا نتأتي أصاب جيسنا جتا هنجون كوي أنش نجي زادي هتسيس not nicht alle dabei خشني زي هذا أي أجي زي الإندبا فإذا الإندبا ناجتا بتشتا ناجو تاخل كنت أو إم جون دويات إيه أدون دا دي كجي إيا early detection ديشنكو أبتسيد كنت أو بنيد نهو دلخاهدا إيه دو ناسو كنت أو دي تسيس بتوليكي تنسيه بعد إحنا اللي هيجي دو أجي إيه يبكي هدول جشتا دوي أجي دول تختخوين زنوبنا أبتسيدك أتزدين فناخدو ساني نخلنيجي هو إيه أجي بن يجحتا خا أزيل إن دبين يا دبنا أدتيلكيل نبدتيلكيل دي شيخي أو أهتيلنا دي شيخ ابن يا أهتيلنا جوهد أو جو بحنا بكيدو إيقف بها زندولك دي خده إيه دي أناش سنبت بنكده كلادا زنلي وتحجكو أو إيه أجو أو شكرو نهانو إيه أجو بحنا هذا هو إيه فليت إيه لاشين هنزن هو أنا سوشين نادي دوش خاودات هيجي إيه يدي ين يد تينش إيه دي هو بأي هو بنكده كلاو X-ray films دي خلينيجي إيه أجدو إيه تينش إيه دو دي لخيت أهوت إيه لا ألو اللي أشعنا خدون وجدا ديت أخوة إليا دا إيه دي ديو كيلي إيه بخيخان دو نشتا دي كيد با إليا داش إيه دو دي كوا أخوة إيه دان دي دا نو دا أخوة أو ين دي خاش لأكو إيه آجا أخوة أو بني إيه دي كوا ناش جي X-ray film جي إيه كون أخوة أو شاتو إيه يابانكو نانا دي كوجي ساني بابا نكندا بالتلاج آج إيا أتيس بتلو دختن سهو أدا بعد هنو يلهيكي بيدن سهو دا جدي إلتناش جناس بانسا نورمال بكا دوت هذا نزل أن جنو يو إيدون جنو هتأونو سيف نو هو نانا non not baby kill nagi nana a decon with off be that nessa la halate ela the ness muscle she be nessado kaila yan di zashi hinzino with all the ness is are you the jeho nana invasive bakagi nana a ajo with all a ya could be the nessa I don't that a obo lichiko that nessa ko they the lymph nodes, a son of the lymph nodes, the bits awesome dust, egin the bit are yahane. I don't die that the kutcher or batch on the anagit or the a sunny sound of the arj or a kutcher away the begishi arj or ich and then arj the bit no be arj bit no safe no arj bit not ich or echo. The breast ducts or glands get out lobes of the clone the yoshiko. A other open there, joy bin ye 100 or this other on the day ask kid when the old she a yen dash ha the oh be who sang on the door other on the day that's a yard eight or that's a yard eight joy ajibin non nice kako. Issues in the ya joke with Ishtan Ido, Lichto with Ishtan Iosendo Lechako. I don't that the breast cancer stages, Ninigi, Joyash Kit when the oh. Try but hello the qua Bazano a at the nest sound of Bazano Ibuka. They it don't know the a ya not or that a sign ya not or that son and Lenigi. Anna so ban na dos ka te no da o e ye ya ki ka to Versteht aber die no ko job ist dann de nils na asha de ya handa ka ka e ya benti to shit ada to dat o e kashin so o ya tsna de ko so to annan ka ani ita to a ho sha nasi dat ne sa do dat ni sa do na tsa se de o sha adon da beket or has ni o sha J ad e in the di at ispit or da kun sahige ya bat no lege ko pep ge shi ab no safe out edo ad kharjish bin yatki lo ya handa ha khata bi no ko e khashin so hot o e ya bis istan de nilzen ab say de hot o e di kujezel enen de nige e khashin so e ajo hot o yil cha a to nan le de hot o bi de nesa do sahagi sabe na cho hot o ni aro da e art and le de bi nesa na e hot o kish adom do kha na ha no da ka nan na hat le hot so e ajo zel en e si pas la ko e hot on khaba da mus no le ko na na di kujaba hashne e di ka sahagi be in le de Bebegi o e bi de nesado e hashin so shi abat e no winzin o e tsahagi be e ade hot o shi kla na chi e hode do lichton de yenda ka ho e ko ta o di ta do lich ado on de ta e ya anaki ya be has anila e di hot o nad e do ka o hot o benign klinige e ya di bat at tania adon da malignant ninige e ya di artistic olige e to e bat no slio da sanni ki da ne sanni ke e dik at the be bi ne san joy ad art ko ke na o e ya hashin so zel in shi ishan na ne do kliko hot o e ke na o ki na ni shin ninige na de nilzen no ko adon da e ya dikulo ya na e ya e ad o shahot o e ya aja kharja shoto dikujo names in betabade ni ho e aja hashin so aja na antin gi e asa tinana do saho nana ko e hashin so al ke na o chi ye ta hat na le adon da pas istan e de yosen ke so nana dikulo ba na anko ha ishe ya be e ya ta ho jin zendo le to Chashit au ba huin zendo lech do o hi go shi hut au ban da ke sto shi bin yeda shi zel inen da badosh kitle ko nana di kuji ya had now zel in ya had now e ya di ho begi kage gi e hashin so she thought the note later ko so the kishi aje with auto later do she ha now when don't need that ko lay at the orange but hage in the no with abi the hot do hot ocean na hadna no hot odi ko begi bikina na to later ko she be a thousands and all this don't none be this igi with abi beach this she be ko begi ha show on national ito like art nana di konegi nana gi ya di bi holz shi le ko e benade ti bi dest e gi hajo ko pegi hot on national I don't just ka hota shi do bi holz do lesta ko e be da hos ni zin shi ya ko ezel in be istan is do lich nana di ko best ha gi sta nana Libby on there, but you learn a lot up. I did not up and don't need that. I could emotion the up at the other shilling years and watch the grass. That sunny, what oh, ya the car, I don't the dying lady, Zel, any nasty hatana kid with the back up in the cut that lada. I don't I don't know what you had me up for laugh if I bought those niche shine or they like oh, you'd not if though a yak up a cut or little. Dort hade nog illa sani the best tagi av danne då ishi av och ishi av och nasko ibitski hot edo the best tagi och la tagi ako oshi oge dana hadna då då nana azel in dashi hot oshi ya hun zendo hot oshi of big this ido the shato ibinye Donna na di kunna ya na hadna igi ya astana iltsado ado daida away da ye iltoda she anna in leho best tado da a beta of the hadin do the a quande dojo tado ado daida the way be just or she be da present and do the be this in give of each this which this that they for bear la try give for best sa give to continue ho ya to shi a hit a da de a delta da bat ho da lo da histan ha no shi a de of be de shi of pa to le to ya be da present and on the azel and she a hit ben ya the home church do gosh do di la hit of it di la ibn na hit la hin no oh nta wat of kha ko di aja hit oh azel in anni do nana azel in yin da kha ko di ya ko zin gi be da ho jin no be be na is kha do be a sa ji hit on na to see do hit on ji hit oh be di national ito hit oh be na is kha aja hit oh ki na on da kha ko Nana Khalid au ataka dishwas Khalid au yashisazido ito padishnita abitsedo abeta hashiado de shifin zentrasto aja atkahudi zehod yehiki zati kwichishi yan lo da transda da wa saya shonada dija tlaitse is it oye hot au nzag wat hot au besinde lo do na sa ya si da be da hot do ki da na so da hot au be khadel klosle anon da sa in le da ho da so a jo hot au hashin za hot au di disney da hal jini ki a jo hot au do bedla hot au sa ai ki ki da ya hot au bi ye a dan ji ho adon da beta husin zindo de saya isina da di lo de kushi se kado beta di zeto ya hasil so di da hatat lo di da a ya da kitle ko shi do business on da khit a da becho na hit e da shi a di de ya des din da jinje ajo hit out khas di zahidi inji ho fayat do shin jon do shi be khaya hot se so ko hot out inji ho Nana di kodot iyan chdenil inigi sto e bach na anko adon dat ian khas ian dan segi e pat pa ten ho sa ya di zen da bi e shi kan sa o di da bi na na di sa ya di zen da bi o e a ja shin so a shi la ba sta kha da o ya di zen da bi ko ado sa ya bi dat o da das tin de shi la e ya satoshi a ya da pa da shi o bi hut o ye besta kha ko e llato hut o be da huzun no di chinyan no di hegi huzo chujosh in do chinyan pa ya da hegi chujosh o shi sto ya te hut o di ko je bahas ne gi do ya hut not I llato do shi hut not I llato sto nana di llai ya bejel no di hegi llach de yo ko e hot alsa baby che hadas te ho e ya o le ko na ya te hada edit in tisigi do ba ya te da jo hot o e khashil so bi istan de ko nana di ko je sa do che de yo no e ya pindi hada ban nan cho in tis do ba ya te da jo hot o e khashil so bi istan de nils no e ya hunza ta ho je sto e sa to benda ni tin ho Nana di Kudobanas Nishigi for Navajo Nation Breast and Cervical Cancer Prevention Program. Dik adihagik at o hayigo e ya dans anjago e ya aslande kapo diesel and a give in the has no healthcare center. Play clinic de no de yojile ko. Alo you see is in the aunt's house and you get in the kudneshi e ajado di peso nante ke ajo to bisin de nisha kunde sani ke hat o e kato in yet not that ka the mammogram the clinical back up in the cut this radio le kai be told the she flea market has because ala ho e she ajo da di ni lan le chilchim bi toje e ajo zed and asked so because in the page then go Kenyan lands ajo shanda kato this ajo do kato o yi ade hine ka no flea market de ade shato ni ka di jato ni ka to ja ade do kato dan hit no around the inscription house e ade to zel na art so has ani ge ade to na do adon dan le pudne she e ade to na do Dido anna de zid ke honda do da asha ajje o e ad na do sha e na kitje ado sa e yan le asha de zid bet na atle honda e sa ho e ya ko asha da cha ho et di mobu yin de shinige den chio but on de zid in was on not had the Nana sa in le ko the four corners le Mexican water do tismas paspatkai kwa zel in levels because Four Corners Regional Health Center they cloned out the yoja aja to sana do ko nanan le tohte e ad e ya Shiprock Northern Navajo Medical Center e ya ai ta sa ad e because ho an le zel in bi on e aja hot o sani ai ta e ba min kanda this ko nanan le pinyan jesto ko sana do chi chen le jesto is it in because an jesto nana sehil le jesto e aja bikidun shi do flato shi manish insin ko aja ki nana to hachi jesto e aja so na lo alo on the tan le Pine Hill no an le na an George de la na an George de ad na lo la sto alo on the through jesto ado Pine Hill Tohajile sto ado sto e hashin so hinan nishlato de nilzen e aja khane jahto e aja sani la abelganik echedo ki da diti e dit nabaza ja aja o be ptahil ne do be ishtan de nilzen an le nal sos khade do nilje sto o ya tlato be khane ja adon le basin ne sto adon the Flagstaff to sto na do na sto e sa to at and kinana shinigi de needs and ho adequacy e ya sani with other show e ya nan shinigi e ya e with unconsider dance ajo do e ya do sa e do a ha da click sa ho e with e adon de adon Arke van aangename slinge de needs and for dit aangename slinging dat ko die dat is ook het al al na mazo begin das niligi do at is eight al e begin de nisha bi beso nan de gi do sa to babik and das ya hagi disani this din don le skante no ba di beta ge enat a jo ababik and das ya ge ya ape het al de beso de nigi chti no karbon zat bordish Idan ka ba na no sindo de do na na di ko je ba che hasta ko di ya a the neck at it oh e sad lenigi cho nigi to e belikanic at ko e breast ni ya adon the cancer ana ki ya kids in the losa di belikanic at ko ko din hit nebaza di hit the nebaza ko ki ya di oh ki wana oh ya pahan ne ko ya ko do ni hit the ne bedla slain lenigi ni hike do hi Binni e hut o ya sad lenigi ein dasik e llodo na zihi jo hut o si ida do tsan ne ko e llodo do zita kwa edna se ne do zita a sword that won't heal jo hut o ya huk eda but ne da hut abe bil hut da shinde khad shi tse koso shi jo sintle ibin na di sadigin da dik asta di no e kati o e khashin so Nihizad lenigi dit ko sani bilindash nishigi don kinat ani lenigi ho e di atis bit or datin se alo baat e no lehigi e khapet bitin se to e stan be beti ni da ho e khapet bitin se khada ast queen ho do ni lot and is in e a llada de mils twi higi e jo a sha a do ho do ni no ja hat net do het afslag op in dat niet hin ko in na e afsad den ni kesen a do di ko ke na ona da ka ge it is bit all e ja di hit sige e ge hat het organic e ja the human body cell ado e ja dachten se ni e yan they develops and it grows and it is tra o het on naso o nasi o te te ani ka ono se lo si ate ho other part no lehiki they uncontrollably becomes abnormal o sa jo that se to nasi o is ka sa go gi ni na don de such e o ajpa na de ti ko chan le gi da e ha pe bi den se e ha gi la harola is ta ha ila yin skido and no to e pe bi den se in the breast area what ya kashin so e at ke na sad le ni git de ni ko e on khaba da no sando de ko alo kumba na shin shige mahazno e na tos na na je kumba ka e an de ta ho zanda ad isi shnat an e asta do ado e banana shin de ni gi yosin ho alo beshbe hanne ho beshbe hanne gi di quite get open in like 6 3 4 8 5 3 na kaislano alo na tos o sa aja bit this children's of the ikona baka fax number nana di patients a case ha nigi aja but oh ka illa ya da kila hadit au atikni na hunsin da so adon da best ba na la do hot e da jo zo da ba ka gi la so che pa de do this no da eco so can be www.ndoh.navajo-nsn.gov issue cost or the Sunday the Panashi Aja dot Kitiko. At the coaching Kahna no I don't think at any Hanana Sigi dot the Aja Basin case Aja Hashing so Twitter that they know with Ashined lang with a hadnet be had long though she a George just on she as the ka eight lot and can had on a con kid the car or a with us in Kinan then they need the hard that they would already only connection should you that only hide the carriage in the sunny that he is a day. I didn't not bahat on the job. He stand at the me. I don't the night the key about on that. I don't know. So I don't have a body. I don't that I just or you seem to know they need and therefore. Ahot all ya hanna egi bisidahagi ada on the tan am hin bisidahagi na habik ida da tik na khaba da hana sindo bel an he da so zenigi hot all san no klinigi be ida ada hana sindo bel adon da ade in nano satligi hot you can lenigi aje be nada no tindo bel ko ya hon zindo bel ye da hon zindo bel to ado hast kuin no klinigi to bi do e san e bedet ko twin the not even and Zealand. I would all young kid now as a little bit teacher, thought he had none a question for a given nature, a quiet a being stoid or a yapping kid on the honor.
Oh, yeah, Miss Todecheenie. Kodo e hana jonna go e nicht on do baaki hinsen she says zinge kodo adanek etchigodot abelagana etchigokot ben hilt on aningi baaki hinsen as twido sani dan ningi the neck etchigoshan the neck etchigoshan da no akot e ya ba konizi akot ben na the ashondet adanek etchigon nicht with the need a yahashin kodot adanek echigodot abelaganak echiko the breast and cervical cancer program though in the breast and cervical cancer prevention though awareness with yahiki eshi kodo yaha the Navajo Nation Cancer Prevention Program aden oshin kodo hanna and lineage eshin kodoni yaha na jonnagon na haigi la ako Ashin Kodo Bilaganak Echigo today, and I would like to thank Miss Rolanda Todecheenie for coming from the Navajo Cancer Prevention Program to explain breast and cervical cancer prevention and awareness and much about their program today. And today we are focused on just breast cancer. However, we will go on into our next series of cervical cancer program on March 23rd, 2022, and it will be released at 5 p.m. on the Office of Miss Navajo Nation's Facebook page. We will have another series such as this again, but specifically on cervical cancer. And so I encourage you to come back to view this video with your grandparents, with your mom, your dad, whoever it may be, your caretaker, to view this video to understand what this actually means in both Navajo and in English as well. This is something that I am wanting for our people so that we can continue to be healthy, grow into old age, and so that we can just be healthy as a people again. And so with that, thank you to the Navajo Cancer Prevention Program and also to their director, Mr. Curtis Briscoe. So